Hi, everyone. Welcome back to the channel. Today, I have Dr. Vikas Patel again with me. He has been on this channel before. You guys loved his content, so we decided to have him back on to talk about longevity and the things that we can do to improve our lifespan and improve the ways we live healthier for longer. Today, I'm talking to Dr. Patel all about supplements because it is such an interesting category, and I take supplements, my husband takes supplements, so many of us take supplements, and it's really hard to know what supplements are actually useful. And when we're looking into the supplement category, how do we distinguish different brands or what to look for on the label? So thanks, Dr. Patel, for being here and welcome back.
Thank you so much for having me. I had a great time last time, so looking forward to this.
All right, so let's dive right in. First thing I want to talk about is what my husband has been obsessed with me asking you. He wants to know all about creatines. So what is creatine and sort of what is it generally used for when it comes to creatine supplementation?
Sure. So creatine is a compound that we naturally have in our system. It became popular, I'd say, probably in the uh, late 80s, 90s, and early 2000s because bodybuilders, weightlifters started to recognize that they were seeing some gains in their performance and their muscle strength when they were supplementing with creatine. So creatine, the form that mostly gets used is called creatine monohydrate. And not to get in the weeds of biochemistry, but our body uses a substance called ATP for energy, and the P in ATP is a phosphate group, and we basically go from ATP, which is triphosphate, to ADP, which is diphosphate. So we lose one phosphate in our muscle tissue when we ask our muscle tissue to do work. And all of our muscle tissue has this ready supply of ATP. And as we lose the ATP and it becomes ADP, we have to replenish that somehow. And that process takes time. That is what fatigues our muscles when we don't have that ATP ready to go. So creatine basically stores an extra phosphate on it. And so when we supplement by taking like creatine powder, what we're really doing is putting this ready source of phosphate in our muscle tissue, and it prevents us from fatiguing as quickly. So there's a couple things that happen when you supplement creatine. One, your muscles actually just look bigger. So a lot of times people feel like, oh, like I started creatine a couple weeks ago and I've put on 5 pounds of muscle. Well, technically, no. You've put on 5 pounds of water weight. The creatine will hold a little extra water in your muscle tissue. So that's one of the first things people notice. The next thing that they notice is that they don't fatigue as quickly in doing their repetitions. So, if you were struggling, whatever weight you use for, squats or bench press or curls, if you were fatiguing by your third or fourth set and you're not able to get to the end of that set, the person on creatine versus the person off of creatine, the on creatine, they're finishing those sets and they feel like I can still go longer than I used to. And those extra repetitions that they're able to finish is what's actually netting them the benefit of muscular hypertrophy and muscular strength. So what they end up recognizing is that over the course of several weeks or months, that they're getting stronger and they're lifting more weight than they were. And the only difference really is that they've taken this supplement creatine. So your husband is right to ask about it. The ideal dosing for creatine is about 5 grams of creatine a day. And when I was a kid, everybody used to load creatine for 2 or 3 weeks. They would get a lot of gas, so they'd get flatulence and this like belly aches and stuff. It turns out that it doesn't really make any difference. You don't have to load it. You can just do the 5 grams a day. People rarely at that dose will notice any GI discomfort. And even if they do, it's pretty limited to about a week. And then it just becomes a daily supplement that people take. Um, there's other benefits that people are recognizing now outside of just the muscle strength and muscle hypertrophy. There's some study done on patients who have traumatic brain injuries, and that they're seeing that people who are on creatine or have a supply of creatine in their system, that they seem to recover quicker from traumatic brain injuries, and they seem to be somewhat protected against some of the injury that happens with TBI, and that seems to be also true for just concussion as well. That people seem to be more resistant to concussion on creatine, and it has to do with the fact that when a brain is concussed, it goes into a kind of a low energy state. It does not use the same amount of glucose that it normally would. And we don't really know why that is. It has to do something with the stunning that happens to the brain parenchyma or the brain tissue. And having this supply of extra phosphate groups in the brain from creatine allows it to keep drawing energy when normally it would have been in a low supply of energy state. So there seem to be these other benefits to creatine that we haven't quite delineated yet, but there are some ongoing studies for.
And when you take the creatine, like you mentioned, how long does it take to actually see the effect of that? So I do weight training twice a week. And do I need to take it every day, or should I only be taking it like the day before or the day of, or does it have to kind of build up in my system?
It has to build up in your system. Once it's built up in your system, so the requirement's a little bit different based on how much you weigh. The 5 grams is basically kind of a simplification. It's kind of if you weigh around 150 pounds, and then you're about right at 5 grams. So if someone weighs 220 pounds, then they may need 7 or 8 grams of creatine for their size, and then also less if you weigh less. I will say, having taken creatine when I was a lot younger, and then not taking it for a long part of my life, and then restarting it in the last 5 6 years, um, I don't notice the differences in when I'm on creatine and off of creatine nearly as much as I did when I was younger, and I think it has more to do with how much I've trained in my life. Um, People who are relatively new to weight training will notice much bigger gains from creatine than people who have been doing this for quite some time. So the ideal dosing is that if you take it once a day for about 3 weeks, you've built up enough steady state in your system that you're hitting all of the maximum improvement that you're gonna get. At that point, if you're taking it once a day or once every other day, I don't think it's going to make a huge difference. It depends, I guess, mostly on how much activity you're doing and how quickly you're using it up. So if you're doing resistance training for 45 minutes, 3 days a week, I think you can probably get away with taking creatine 3 or 4 days a week, and that's probably fine. If you're doing a lot more exercise than that, then you probably need to be on it on a daily basis.
So does it mainly help with the reps, as you said, or does it also help with aerobic activity? Like, will it make me run longer, walk longer, do Peloton longer? Will it help with any of those aspects?
It's not super likely that it's going to help a lot with your steady state cardio. It will help with hit training though. So if you're doing, you're breaking out into these high intensity sessions where for 30 seconds or a minute and a half, you're going at a really high pace. Well, you're demanding a lot more ATP all of a sudden. And that's where the creatine can help you. But if you just say, I'm going steady state, I'm going to jog, a 6 minute mile, sorry, a 10-minute mile for 1 hour, right? That steady state, you're not typically going to be using a whole lot of that high intensity ATP, and so it's not going to net you the same benefit. It's really for in resistance training and high intensity training where you're using those very intense short bursts of energy.
Yeah, 6 minute mile. I haven't done that in a very long
Yeah,
time, if ever.
same. Same.
Um, but what are the risks of taking creatine? So, of course, you did mention the GI side effects, but are there any like major health risks where patients really shouldn't be on it? Anything that you would say is like a real severe contraindication?
No big red flags. The big thing when I was younger was creatine is bad for your kidneys, and this has been studied quite a bit. And there does not really seem to be any real deleterious effect of to kidneys. The one thing that I think may come up from time to time is there are some times when people are lifting quite a bit and on creatine, they may see that their creatinine has gone up a little bit, and that isn't actually a true indication of them having developed some mild kidney impairment. If you look at, there's another lab that can be used to determine kidney function and glomerular filtration rate (GFR), and that's what doctors basically are talking about when we say that somebody has developed kidney disease. We use a couple lab values to estimate what their glomerular filtration rate is. And the most common one that we see, which is on every standard lab panel, is a creatinine. And we look at this BUN and creatinine ratio, and we know what sex the patient is, what ethnicity they are, and there's these calculators that basically say that if your creatinine is 1.3, your GFR might be 45 or 50, and that might indicate that there's a little bit of chronic kidney disease. In the weightlifting population or resistance training population, that creatinine of 1.3, which might technically be abnormal on the reference range, it's not actually abnormal when we look at a cystatin C. Their cystatin C, which will also give a very accurate measure of their glomerular filtration rate, will be completely normal. And so this topic has been studied. There just does not seem to be a lot of downsides to taking creatine. The only thing I'll say is because of the fluid shift that happens from creatine, some people do get some muscle cramps. And so you're sequestering some fluid in muscle tissue as you're loading, as that first few weeks of creatine is building up in your system. So the really important thing is that you have to drink a lot of water. And as you're drinking water, you're really kind of preventing those muscle cramps from happening. But that's probably the most common side effect outside of GI issues. And there are no other major side effects. It doesn't seem to have effect on liver or kidney or anything like that.
And all of this is, of course, in moderation. I imagine that if you take a very high dose of creatine that is, way higher than the 5 grams or way higher than what is appropriate for your body weight, then you could run into kidney issues.
I don't know the answer to that, to be honest. You basically are peeing out most of the excess, so I don't know that there's a really big downside to taking more, other than you're wasting your money and you're probably just peeing it out. But in theory, it is, I guess, possible that there could be some kidney side effects, but I haven't looked at the literature for that.
Yeah, so I think the moral of the story is if you are considering taking it, just check with your PCP, make sure it's okay for you to take it. Um, Make sure you don't have any underlying, I guess, chronic kidney problems to begin with before you are taking something that could potentially affect your kidneys. Anything on the longevity side of things when it comes to creatine? Because I'm imagining if you can have more muscle, then that is good for your long-term health.
Yeah, exactly. So the whole point of taking creatine, if you're not an athlete, is the goal is to have as much muscle mass as possible as we go into our later age. There's a lot of studies that basically say that if we carry more muscle mass into our 60s and 70s, then we are protecting ourselves from a host of issues. Most people that are carrying more muscle mass have a higher bone density. Uh, if you have high muscle mass, what really is happening is that we are providing the stimulus for our bones to stay strong. The pull and the tension of the muscle attachments to the bone are what gives our bone the necessary stimulus to say, please lay down more foundation. And if we do that, then we're all going to fall at some point accidentally. Uh, if we fall and we break something because we have low bone density, that's not as huge of a problem when we're 20 or 30, but it becomes a much bigger problem when we're in our 60s and beyond because we lose a lot of function uh, uh, in the recovery process. And the goal here is that if we're giving ourselves the largest insurance policy possible by increasing our muscle mass, subsequently increasing our bone mass, then we're probably netting ourselves quite a bit of gain. We had spoken in our last podcast about VO2 max, and while resistance training isn't necessarily the best way to increase VO2 max, there aren't that many people who look like they're in good shape, meaning they look like they have muscles and their clothes fit them well. Those people, even if they're not doing a ton of cardio exercise, they are preserving their VO2 max by their resistance training. It's just not the most efficient way to get the highest amplitude of VO2 max, but they are definitely setting a very good average VO2 max for themselves. And if they keep doing that resistance training, then they keep seeing that gain over a long period of time, and they don't have as much of a fall off later in life.
Yeah, this is really interesting stuff. So speaking of muscles and bones, the next supplement I want to talk about, or vitamin, is vitamin D. So of course we need our minimum amount of vitamin D and more as we get older for bone preservation and prevention against osteoporosis. But what about vitamin D supplementation? Like actually taking more than your, recommended daily value. What are your thoughts and views on that?
So vitamin D somehow has gotten somewhat controversial lately, and I'm not entirely sure why. I think it has something to do with we don't we don't have a great idea of what is the actual amount that is the ideal for everyone. There's a recommended daily allowance, and then I'd say there's what most people should probably be taking if they found that their vitamin D levels are low. So when we test vitamin D, the generally accepted guideline is that if your vitamin D levels are below 30, you're deficient. If you're below 15, then you're kind of in trouble, and we start worrying that you're going to have problems with bone integrity. So vitamin D, our bodies produce vitamin D naturally, and we require sunlight in order to convert vitamin D2 to D3, which is the active form of vitamin D. People who are Caucasian and have light skin, generally, for them, if they're getting about 30 minutes of sunshine a day, where they're exposing at least about half of their body in a 30-minute increment, then they are most likely getting enough vitamin D from the sunlight alone. I live in Chicago, and now we've kind of entered the doom and gloom phase of Chicago weather. We don't get a ton of sunlight through the winter time, and I have brown skin. I'm definitely not getting enough vitamin D. And every time I have it checked, it's always low in the wintertime. I do better in the summertime when I don't, if I haven't supplemented. I tend to exercise outside. And so if I'm going for runs outside, I'm typically getting enough sunlight during the summertime, but not in the winter. So generally, if most people are taking about 5,000 international units of vitamin D a day, they're usually in the ballpark to be able to get enough vitamin D into their system. The things that are difficult for some patients is that so darker skin tone definitely hurts with vitamin D because we're not our our skin is adapted to block out some of the harmful effect of UV light. And UV light is actually what our skin is using to convert vitamin D2 to D3. So darker skin tones generally have a lower vitamin D level, especially when those people live in northern climates. People who are overnourished or overweight, vitamin D is fat soluble. So the more adipose or fat tissue that we have, the more that vitamin D is sequestered in the fat tissue and not in our circulation to help us when we actually might need it. If our levels are low and we need it for bone deposition, we just can't get it out of the fat tissue, even though it's there. So these are also patients who may run a little bit low, serum levels may run low and have to also supplement.
Hi, everyone. If you've enjoyed this interview thus far, be sure to hit the like and subscribe button below. It not only helps the channel, but helps out all the people that we interview. Thanks for watching. And how is the relationship with calcium and vitamin D important?
Sure. Great question. So calcium and vitamin D go together. We need both of them to mineralize bone. Calcium is a separate from its uses in bone. It's also a cation in our bloodstream, and it's necessary for muscular contraction. We see this most frequently with heart muscle, where calcium there's an entire class of drugs that are targeted towards contractility of the heart called calcium channel blockers. But for most people, the important thing with calcium really has to do with bone metabolism and generating bone deposition. So vitamin D and calcium go together. In general, we tend to get enough calcium in our diet. The problem is for patients who have osteoporosis, and most of those people that have osteoporosis, they're having it for a couple different reasons. Some women will get osteoporosis if they've had a history of breast cancer and they're on estrogen receptor blockers. Almost all of those women have to be on some type of calcium and vitamin D supplementation. And then sometimes they also have to be on bisphosphonates, which are a drug class that help us to rebuild bone. Another group of people who tend to get get osteoporosis or osteopenia are postmenopausal women, and it's a similar thing. Their estrogen levels have gone down now, and so they also need to supplement. Um, the last bucket of people are the people I'd say that are kind of in the if you're not using it, you're losing it category. So if you're not doing some type of resistance training throughout your life, then you're likely to have lower bone density. Our bone density typically peaks at around age 30. And so when you look at DEXA scans, which are done to look at our bone density, we're always comparing the result of a DEXA scan to young, healthy, normal. And young, healthy, normal is the group of people between 20 and 29 years of age. And we want to know, well, that's when their peak bone mass was. Where are we now at age 65 or 75 compared to that young, healthy, normal cohort? And so if we're falling, 2.5 standard deviations below young, healthy, normal, then you have osteoporosis, and we got to do a major catch up by putting you on calcium supplementation, vitamin D supplementation, and then typically some bisphosphonate, and I would say resistance training. All of my patients, if they're not at least at the 60th percentile for bone density, I tell them, all right, we got to start resistance training because I want your bone density to be at least the 75th percentile going into your 60s and 70s.
And how does bone density sort of impact you as we get older? Does it lower your rate of fractures? Because we know, hip fractures are a big deal in the elderly population, but what's kind of the real importance of building that up?
Yeah, so that is the primary thing that we're trying to avoid. We're trying to avoid fractures. And these statistics have remained about the same over the last 30, 40 years that we've been tracking it. But uh, there's significant morbidity and mortality related to hip fractures and wrist fractures. Hip fractures much more so, but these are the two fractures that are the most common. Vertebral fractures, hip fractures, and wrist fractures are the three most common fractures that occur after the age of 65. And they're all fractures from falling, and typically falling from standing height. So the problem with hip fracture is that there's about a 30% chance that if you have a hip fracture in the next year, you are going to succumb to either either die early in the process of the hip fracture, meaning you didn't survive the hospitalization to repair it, or if you do survive the hospitalization or repair it, there's still this 30% mortality rate at 1 year because of the function that you've lost, the decrease in your VO2 max that occurs while you're convalescing, the increased rates of infection that occur when you are convalescing. People just don't seem to be able to regain the strength that they lost, and they're not able to rehab correctly. That nets a lower quality of life after the fracture and puts them at a much higher risk of mortality, of death. And so this is what we're trying to avoid. If your bone density is still somewhere at the 50th percentile, the likelihood of you falling and actually breaking something is much, much lower. So when we look at, I get patients in the ER when we have to ask them, how tall are you, right? And my 80-year-old patients will say, well, I used to be 5'10", but now I'm 5'8". Right. They're 5'8" now because they've lost height of their vertebra. They've developed compression fractures. They've developed some desiccation of their discs over time. So nobody really wants to get shorter as they get older, but this is just a natural process that happens. And if we're not doing some sort of resistance training to supplement that integrity of our bone, then we tend to lose it over time.
Yeah, really fascinating stuff. Another supplement that I was really curious about that I have heard so much about lately, and I've always known about it, but magnesium. I'm talking about for sleep, for pooping, for everything.
Yeah.
What is your opinion on magnesium? And I know there's different types of magnesium also. So can you give us some insight onto that supplement?
Sure. So magnesium, it's another cation in our system. It's used for a host of different activities. I mean, last time I looked, there's over 300 different reactions in the body that magnesium is kind of integral for. Um, the big ones that we get really worried about have to do with muscular contraction. If we don't have magnesium in our system, then we cannot effectively uh, do work with our muscles. And so many times we'll hear patients that say, I feel like I have no strength, or I keep getting these muscle cramps. And we check their magnesium levels, and their magnesium level is like 1.0, which is really pretty low, or it's 0.8. A healthy magnesium level should be 1.6 or higher. And so this is the most common reason that we might see somebody in the hospital setting with low magnesium. But magnesium is used for a lot of other things, like what you were mentioning about maintaining GI health and sleep. There's even a fair amount of data now about just cognition, that having high levels of magnesium in our system improves our brain function, memory function, that people perform better on cognitive tests. The the different forms of magnesium are important because uh, they have different kind of side effects, I guess, more than anything. So a common thing that ER doctors will prescribe when someone's constipated is magnesium citrate. So it's used as a laxative. Yes, you do absorb some of the magnesium into your system, but it creates quite a bit of diarrhea to wash out everything that's in your system when you're constipated. So people taking magnesium citrate as a supplement to improve their magnesium, they tend to have these not great GI side effects. If you're always kind of a constipated person, then I guess it's okay to take it. But there's other forms that may be a little bit easier on the GI tract. There's a form called slow mag, and then there's a more expensive form called Magtine. Magtine is magnesium threonate. The interesting thing about magnesium threonate is that other than it's the only form of magnesium supplement that actually crosses the blood-brain barrier. And so this is the form that we associate with better sleep and with cognitive improvements. So for people who are struggling with sleep, there is some studies out that say that magnesium threonate can increase the amount of deep sleep that patients are getting. The studies are not they're not super robust. I think the dosing of magnesium was probably not the best in the study, but they showed there was a study that was on that showed that it was in a I think in a Chinese population, and that on average the patients who received magnesium threonate got about 7 to 9 minutes extra of their deep sleep. Considering that a normal person gets between 70 and 90 minutes of deep sleep a night, um, I don't know how much difference 7 or 9 minutes is making, but I think that if they were taking a little bit higher dose of magnesium, the likelihood that their deep sleep would have improved might have been a little bit higher. The population that was being studied, it was all older patients. So it was all people 65 and older. And as we get older, we tend to have, in general, less magnesium floating around in our system. And we tend to also have less deep sleep. And so anything that increases the amount of deep sleep that you get is likely to benefit not just your mood, but also your cognitive function. There are studies that have looked specifically at recall ability and taking magnesium threonate, and they found that people who took magnesium threonate scored better on cognitive tests looking at recall. So there is this benefit there, and I think that it's it's likely a very safe supplement that people, especially getting into the latter half of their life, would probably benefit from. Magnesium threonate of all of the forms of magnesium is probably the most expensive, so that might be the rate limiting step. But it does show that there are benefits to it.
So the thing with magnesium and actually any supplement in general, and this is another question that I have for you is, so I take a multivitamin, right? I'll be honest, I don't look too deep onto the label as to what it is. I'm like, oh, one a day
Yeah,
women's or whatever. I still take my prenatal gummies because I like the way they taste.
yeah.
Um, so I guess my question is that, if you're taking a multivitamin and it says, 100% of the daily value on it, is that enough? Or are these benefits seen with like extra magnesium?
So if you're taking it, we are supposed to get about for women, I want to say it's about 320 milligrams of magnesium. For men, it's 100 more, 420. Um, the reason we're supposed to take that much is because we can't absorb all of the magnesium that we take in through our diet. We absorb somewhere between 25 and 75%. So it's a big spread, and it has to do with what you're taking it with, what form it comes in. So certain foods will, even though they have a pretty high magnesium content, if they have a lot of fiber in them, then we tend not to absorb as much of the magnesium that we're taking in dietarily. So we end up expending somewhere in the ballpark of around 150 milligrams of magnesium daily. That's how much our body is using. And the theory is that if we're taking 400 milligrams, that we're absorbing probably, 250 of that, and that's probably covering the amount that we're losing in a day. So the simple answer to your question is if you're taking, a multivitamin that says that you're getting 100%, you're probably on the safe side. If you're trying to stack the odds, like for instance, like you have poor sleep quality and you want to specifically take magnesium for sleep, I think you have to supplement with something like magnesium threonate because it's actually able to cross the blood-brain barrier, which most of the regular magnesium that we take from a dietary standpoint does not. So that would be the difference. But just for general health, making sure that your muscles are functioning correctly. I didn't talk about it, but magnesium is used for glucose metabolism. It's one of the cofactors that's necessary. So for all the normal body processes, I think if you're taking a one-a-day supplement or your prenatal vitamins, you're likely getting enough. It's if you're trying to stack the odds in your favor for these smaller use cases, that's where I think you need to look at something like magnesium threonate.
Awesome. Now, the last supplement I want to talk to you about is zinc because you see it everywhere and everyone's like, oh, it's going to prevent you from, falling sick or getting a virus. And all these like, you go down the kids aisle in CVS or any drugstore and it's like zinc, 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 for the kids. What's your opinion on zinc?
Zinc, one, it's an essential nutrient, right? So we have to have it. It's another one of these things that we generally get enough of it in our diet that we're not in trouble. So it's absolutely essential. You cannot survive without zinc. It's one of the trace elements that we tend to get enough of just through all of the regular food that we eat. Um, Vegans have a harder time with zinc again because their diet does not typically include the sources where that zinc is most frequently gotten from. So shellfish has the highest amounts of zinc, followed by beef, and then chicken, and then eggs, and then there are a bunch of plants that have zinc in them. But um, the main problem with the plant sources is that most plants are also high in fiber, and the fiber blocks some of the absorption. So for people who are strict vegan or strict vegetarian, uh, they would really do well in taking a 1 a day vitamin supplement that's going to get them their roughly 10 to 15 milligrams of zinc that they need in a day. To answer your question about all of the other things that zinc does, so we know that people, mostly from studies on third world populations that do not have access to a pretty robust diet, they tend to have zinc deficiencies, and we know that they are much more susceptible to GI illnesses that cause diarrhea, that they're much more susceptible to community-acquired pneumonia and viral URIs. So there are studies done that look at, well, can you give zinc in order to prophylax against a viral illness? And the conclusive thing I think that we can say for sure is that if you're taking these big doses of zinc, like you've seen probably Coldies, those tablets that you suck on, um, if you're taking those, you do decrease the duration of your cold. So you have to take them pretty frequently. It's not like you can just take one or two and then you're done. You basically have to take them throughout the day until the cold is done. And it on average reduces the length of your cold by 2 days. It does not reduce the severity of the cold. So all of the symptoms that you were gonna get, your cough, sore throat, headache, fever, all of that stuff, you're still getting all of it. You're just getting it for 2 days less than you might have otherwise. So that's one thing. The studies on can you take a daily zinc supplement to reduce the likelihood, those haven't seemed to pan out. It doesn't look like if you're taking a big dose of zinc that's going to really reduce the likelihood of you getting infections. For most of the developed world, we're getting enough zinc that it's enough to support our immune function. And so most of us are not truly zinc deficient. The real question is, if I take more, am I going to somehow get this added benefit? And I don't think that the literature supports that.
Yeah, no, I just remember I see it in the aisle and I'm like, should I be
Yeah.
buying all this stuff? I don't know. I'm naturally a little bit of a skeptic when it comes to supplements sometimes. So this was really a fascinating discussion. So in terms of like all the supplements that we just talked about, I want to ask you personally, do you take any of these supplements that we talked about?
The only supplement that I take out of the ones that we talked about is creatine. Magnesium. I didn't talk about the foods that are rich in magnesium. I eat a ton of almonds. That's what I use as my snack food, and almonds, Brazil nuts, cashews. They all have a pretty high content of magnesium. So generally, between just what I eat in my regular diet plus my snacks of nuts, I think I'm probably getting quite a bit more than what I need for magnesium. Um, so I don't supplement that, but maybe as my sleep starts to deteriorate as I get older, I'll probably look into magnesium 3 and 8.
And then what about zinc? Only when you're sick.
All right, so this is just anecdotal. I feel like when I've tried zinc, I feel like it has shortened my cold and that I feel better quicker, but it leaves an awful taste in your mouth. Like there's this metallic aftertaste, and the last time I got sick, I like in our medicine cabinet at home, I have some coldies in there, and I like reached up and got it, and then I was like, but then my food's gonna taste so bad, and I put it back away. So that's the side effect of zinc of those supplements is that they leave this metallic taste in your mouth, and nothing tastes right for about 2 days. So I've chosen just to deal with the cold and not take it, but it has worked for me in the past.
Yeah, no, the struggle is real. I was asked to take iron supplements during my pregnancy, and I was like, "Bleh." I was like, just give me the infusion. I can't do this. I was like, I
Yeah,
can't do this. Just IV, please. I can't do this. Uh,
totally.
this was really fascinating. I learned a lot. We'll definitely have a follow-up video because there's, tons of more supplements to cover. But
Yeah.
I think I've taken up more than enough of your time today. But thanks so much for being here. And remind us again about your practice outside of Chicago.
Yeah, mdlongevitylab.com. We kind of deal with all things longevity, including supplements, but really we're focused on trying to improve people's health for the entire health span of their life. So you can find me at mdlongevitylab.com and email me at info@mdlongevitylab.com.
Awesome. Thanks for being here.